Welcome to Joy in Our Town. My name is Arlene Mukoko, and our issue today is health, and our topic is clostridium difficile, or C. diff. And we're joined by John Lillis. He's the co-founder and director of the Peggy Lillis Memorial Foundation. Thank you for joining us.
Thank you for having me.
Okay, so we're going to start out with what is clostridium difficile, or C. diff? That's a tough one.
I appreciate that it's a difficult thing to pronounce. Clostridium difficile is a naturally occurring bacteria. It exists in nature. It can be found in soil, and it can also be found in the feces of certain animals. In and of itself, it's a bacteria that's related to botulism and tetanus. On its own, it's not necessarily dangerous, but what happens is that human beings can ingest Clostridium difficile spores. And then once they've ingested it, if they take an antibiotic or have chemotherapy, in some cases HIV, can cause what they call a precipitating event, which will make the spores turn into a sort of toxic form of Clostridium difficile that then begins to grow and damage the colon.
It's interesting. So how can you relate it to tetanus and botulism? What is that connection?
Well, the connection is that all three of them are part of a sort of larger species of bacteria called Clostridia, and it has to do quite a bit with how they look under the microscope, and the fact that, you know, they are naturally occurring. They're not sort of man-made.
Okay. And for some of our viewers that don't know, tetanus and botulism, what are those?
Tetanus and botulism are both bacterial infections that you get. I think people will most think about getting a tetanus shot after you've cut yourself, and so tetanus can get into a wound and can, you know, cause you to, you know, have an infection that can lead to lockjaw. Botulism is actually the same thing that is used in Botox, which is the thing that plastic surgeons use to paralyze people's faces. But so, again, in and of themselves, they're naturally occurring. It's just what they do in the human body that can be dangerous.
Okay. So why is C. diff such a threat to public health?
C. diff is, I'm sorry, excuse me. C. diff largely occurs in healthcare facilities. It has been typically seen among nursing home patients and people in healthcare settings that are in for a prolonged period of time. It is very hard to control in terms of spreading it. Most often it is spread by being placed on surfaces, and then a patient will touch the surface, put their hands to their mouth, ingest it, and shortly thereafter they'll come down with what's called a Clostridium difficile infection or Clostridium difficile associated disease. And so it's a threat to public health because it's invisible, and a lot of the techniques that hospitals have used to control other hospital-associated infections, like MRSA and staph, don't work on C. diff. The only thing that really kills C. diff is bleach. So a lot of the hand sanitizers that physicians have been using to help minimize the spread of the other hospital-associated infections don't work on C. diff.
Interesting, interesting. So how is this treated once people are diagnosed with C. diff?
The primary way that it's treated is, ironically, with other antibiotics. In most cases, they use Flagyl or vancomycin, and you might be put on a 10-day dose or a longer dose depending on how profound your illness is. For people that have severe infections, there are various strains of C. diff, and some of them make people much more sick than others. Treatment can lead to the removal of the colon in some cases, and also for people who have a milder case but one that won't go away through the basic treatments of antibiotics, they might use something called fecal bacteriopathy, which is basically a stool transplant. And that sounds really, really icky, but it has anecdotally about 100% success rate.
Wow. Interesting. Very interesting. So how can a person prevent an infection? You talked a little bit about how someone can contract it. Can you talk about that?
The primary way that you can prevent C. diff is by being very thorough in your hand washing, particularly when you're visiting somebody in the hospital, or if you yourself are a patient in the hospital, or in any sort of public health setting. Increasingly, it's being seen in the community. You know, my mother, for whom the foundation is named, had not been hospitalized in 30 years. So we're assuming that she picked it up. We'll never know, but we're assuming she picked it up maybe visiting somebody in the hospital, or from somebody she came into contact through as a teacher. So hand washing is really pivotal. The other thing I would say is, if you are in a healthcare facility as a patient, or if you're in a nursing home, if a doctor or a healthcare worker comes in to treat you, ask them to wash their hands in front of you. A lot of people get nervous about sort of pushing back on healthcare workers, but it's really important because they're very busy and they can be very, very well intended, but in that split second where they think they've washed their hands or they moved from patient to patient really quickly, you to just be to be gentle but firm in reminding them, please wash your hands and put on gloves before you touch me, is a great way to help in prevention.
Wow, that takes a lot of courage too, to be able to say that.
I mean, most of the doctors that we've spoken to through the foundation, they appreciate the reminder, because, you know, if you're in a hospital and you're coming from, you know, say a patient who had, you know, coded, God forbid, and then you're racing in to see somebody else who's not well, or, you know, to have that, the patient, or if you're the family member of somebody who's elderly or unable to advocate for themselves, just to give them that reminder, they generally appreciate it.
That's great, that's great. So tell us a little bit about Miss Peggy Lillis.
So Peggy Lillis is my mother. She was a kindergarten teacher in Brooklyn, New York. She taught in the Flatbush section. And she was a single mom for most of our lives. I have a younger brother, Liam. And after my parents split up when I was 5 and Liam was 2, she not only raised us on her own as a single mom, but she also put herself through college, put me eventually through college, and became a kindergarten teacher, which was really her lifelong ambition. And she was a very beloved person in our community. She was very active in advocating for the children that she taught, and also for me and my brother when we were in school. And she had a deep belief in the power of education to change people's lives. One of the reasons why we've positioned the foundation as an educational foundation is because of the belief that she had, that if we can educate people about C. diff and how to prevent it, we can save lives.
And what is the foundation doing to address this epidemic?
Primarily, we're involved in public education. We hosted a fundraiser last fall where we had about 300 people. We had a physician come and speak to them and begin the educational process. Those people were encouraged to speak to their family and to their doctors. We're in the process of developing a public service announcement that will be first distributed through the internet, through a larger internet-based campaign. We're also working with doctors to write opinion pieces to be placed in, you know, magazines and on blogs and in newspapers to just get the word out there about this infection, because it is largely preventable.
When did this happen? And I'm sure this must have been, you know, kind of a surprise. You mentioned a little bit about, you know, the time that she contracted it, and you know, it was a matter of days.
It happened, it'll actually be a year, April 21st. It happened on April, she became ill on April 17th of last year. She had been treated for an abscess, a root canal abscess, and she was given an antibiotic. Within a couple of days, she came down with what appeared to be a stomach bug. Because she taught kindergarten, she didn't think anything of having a stomach bug, neither did we. It was only when it persisted for about 4 days that we decided to take her to the hospital. And, you know, very sadly and shockingly, she passed away within 72 hours of being admitted to the hospital.
Okay.
I'm sorry, 36 hours of being admitted to the hospital.
Okay. And so this is a fairly new foundation, and what's next for the foundation?
What's next is, increasing the amount of education work that we do. Primarily through the internet, though we also do want to create public service announcements that will play on the television and on the radio, and also having more opportunities to go and speak to the press in forums like this, bring that educational message out there. We're also going to be developing patient-focused brochures. One of the things that we really struggled with, we were very shocked by what happened to our mother, and we didn't have a lot of time to think about it. But in the weeks afterwards, as we tried to understand this illness that we'd never heard of, we couldn't find anything that was for patients. It was all, stuff that was written very academically. So we're going to create real patient-focused education materials. And then we're also looking to work in coalition with other nonprofits and other patient advocacy groups to eventually have this disease designated as a reportable disease in New York State and then probably in other states. Because right now, hospitals and doctors don't have to report cases of it.
Okay. And it's not as widely known as, let's say, botulism. People are not that familiar.
No, or MRSA. It's funny, in the time that MRSA has been declining, this has been increasing.
Christian John Lillis, thank you so much for joining us and sharing with us this important information.
Okay, thank you so much.
And thank you for joining us. We'll be back after these messages.